The following is a commercial program paid for by Harrison Vein and Vascular Center. The opinions and views expressed belong to its sponsors and are not those of Nexstar Inc., this station, or their affiliates or employees.
Hi, I'm Dave Woodman, and I'm here with Dr. Lonnie Harrison of Harrison Heart, Vein, and Vascular Center. Dr. Harrison, it's always good to work with you, and I have some questions for you today that our audience may have as well, and we want to educate them as much as we can to some of these things. I know you treat chronic venous insufficiency, but what are the symptoms that are associated with that?
Yeah, Dave, it's good to be here with you as well at Channel 4. Chronic venous insufficiency is kind of a broad term that says a patient may have vein issues or vein problems. And usually what that means is there is a problem in returning blood from the feet to the heart. And the biggest culprit of that is the biggest vein in the body, the biggest vein in the legs rather, which is the greater saphenous vein. If it gets congested and pools blood, then the patient begins to have symptoms because blood's trying to move against gravity, and it does so through one-way valves. And when those valves are not functioning well, blood just stays pooled and doesn't get back to the heart in an efficient manner. So what we do is we treat that vein. When we get rid of that vein, the blood then follows an efficient manner of getting back to the heart because there's thousands of miles of vasculature in the legs.
Well, is this a pretty common disorder?
It's very common. It's a very common. In fact, it's projected that about 40% of the adult population has chronic venous insufficiency. That's a large number. Just looking at Arkansas alone, when you figure there's about 2 million adults in Arkansas, and you take 40% of that, you're looking at 800,000 people having the disorder. Not all of it needs to be treated, but about 20% of that needs to be treated. So you're looking at a very large number of people that have the disorder.
That's an incredible number. Are there groups of people that maybe certain lifestyles that seem to be more prone to this disorder?
Yeah, so number one, chronic venous insufficiency is a genetic issue. It's passed down through families. So if your mom or dad had the problem, then it may be passed to you and you have the problem and so on. However, there are groups of people that are more predisposed to having the problems, and that is people that stay or stand on their feet all day long, like hairdressers or retail people, or people that work in construction, or any number of occupations, teachers for instance, that they're on their feet all day long. That just worsens the problem, and those are the people that really have severe problems down the road.
Well, how is this diagnosed? Say a patient comes in, I come in, how do you diagnose me?
So first of all, we take a history. We want to know what your symptoms are. Are you having trouble standing for long periods of time? Are you having swelling in your legs? How many people are treated for swelling in their legs with a diuretic like Lasix, and no one knows why they're being treated? They just have swelling, no one knows. So people come and they have symptoms like we stated, and then we do an ultrasound. An ultrasound will let us look at the veins and see if those valves are working correctly or not working correctly, and then we'll know what to do as far as treatment goes.
And let's progress toward treatment. You've diagnosed me, I'm a candidate, what do you do?
So yes, if you're a candidate and you've got all the symptoms that we look for that's important, and the ultrasound shows that the vein is dilated and not working well, the valves aren't working well, then what we have to do is eliminate that bad vein. By eliminating the bad vein, we then push the blood to the good veins. And so to do that, we just simply give an injection of a medication, and that strips the inside lining of that vein, and the vein shrivels up and goes away over a period of days or weeks. In the old days, I'd take you to the operating room and strip it out, called vein stripping. Not a fun procedure for either the patient or myself. But nowadays, it's a 5-minute procedure in which we inject a medication.
Much success, I assume, comes from this method of treatment.
It's incredible to success. 98% of our patients do better. In fact, is the majority of the 98% will say, hey, I'm completely healed. I have no more symptoms. I have no more heaviness in my legs. The swelling has gone away, etc.